Well, welcome to the next episode of the Mississippi Kidney Foundation Mississippi Kidney Cares podcast. Thank you guys for joining us once again for this next edition, the first virtual edition, and we'll discuss why a little bit later. This episode is virtual. Thank you always to Alliant Health Solutions for being our lead sponsor on this project. Thank you to all the viewers who tune in each and every episode to learn about kidney disease and how we can help each other, not just in Mississippi, but around the country for people dealing with kidney failure. I'm so excited. This is one of the more important episodes that we've ever done to this podcast. It is extremely personal to me, something that's been a big part of my life for over 10 years now. You've heard me mention in the very first episode, Alport, and that is the disease that I found out I have in my kidneys and called my kidney failure. But it affects more people around the country than you might imagine. For the first time ever this past December, I met a young lady who had Alport, and then maybe the next week or so, I was connected with the Alport Syndrome Foundation. So I'm so excited to invite a good friend of mine who we've worked together on a couple of things the last couple of weeks. Lisa has been phenomenal. We talked about things all the way down to genetic testing and how that can impact families. So I'll let the guest for this week come on and introduce herself and talk about what her role is with the Alport Syndrome Foundation. Lisa?
Thank you so much, TJ. It is just my pleasure and my honor to join you on this podcast and be with you. And I'm so glad you've gotten connected to Alport Syndrome Foundation. I hope we can continue to sort of maximize each other's work and help each other as we try to work to support and educate patients across the country living with chronic kidney disease. And as you said, you have Alport syndrome. I have Alport syndrome. I am an Alport patient, and so is my son. My son was first diagnosed when he was almost 12, and that's how I finally got my correct diagnosis of Alport syndrome, our rare genetic kidney disease. I was misdiagnosed with the wrong kidney disease for more than 40 years. And once I started getting involved in volunteering at Alport Syndrome Foundation, it made such a remarkable difference in my own family's life. I ended up some years later actually becoming what I am now, the executive director of this patient education support and advocacy organization that was started by families and continues to be led by families. We have 3 staff members, 8 board members, lots of wonderful volunteers, now including you. And our role is really to educate and support and empower patients and to directly invest in research, to advance research in our rare kidney disease. Before Alport Syndrome Foundation was established by families, there was very little research, very little published research, and 0 clinical trials. And right now, pretty much every kidney journal you can open will definitely have some sort of published articles on Alport syndrome. And now we have more than 6 clinical trials in the US that are currently including Alport syndrome patients in their studies. So we certainly want to advance treatment and options and make sure patients get educated and empowered about their disease. So that's what we do every day.
Absolutely. And when we talk about Alport syndrome, can you just give us a brief description of what Alport is? Because when I was diagnosed with it, I had no information of it. I never heard about it. And when people ask me, even to this day, what caused my kidney disease, and I tell them about Alport, most people have no clue of what it is. And of course, for so many years, they talked about, well, only men can get it, or it's more for young men that have Alport than young women. So just talk about that myth and talk a little bit about what Alport is and how it affects kidneys.
Yeah, sure. It's a really good question. Let me tell you, you are not alone. Most of us who get diagnosed, I talk to patients all day, every day from around the country, around the world. Most of us, when we get diagnosed, have never heard of it. We certainly had, my own family had not. So Alport syndrome is really caused by genetic mutations in the alpha 3, 4, or 5 collagen gene in our bodies. And collagen develops these basement membranes in our kidneys, but also in other organs in our bodies, including the ears and the eyes. So often the ears and the eyes are often or frequently can also have conditions associated with Alport syndrome. And being genetic, obviously it's passed down in families. So often you'll see that it's genetically inherited from parent to child, or sometimes, at this point, the prevalence is, research shows, about 15% of the time, maybe more, it can be spontaneously a new genetic mutation in a family. And Alport syndrome actually was, the reason why it's called Alport was because Cecil Alport was the researcher who followed in his own family and saw a group of families and noticed this pattern in hearing loss and end-stage renal failure. And so in noticing this pattern and documenting it, that's how Alport syndrome was actually discovered to be a specific condition. So it's named for the researcher Cecil Alport. So Alport syndrome is a rare kidney disease, and it's an orphan disease, meaning that rare is less than 250,000 patients documented in the country. And orphan means there's no specific FDA-approved treatment for our disease. So you're right, it used to be thought, this is outdated thinking by far at this point, that it was only affected males. But that's often because the most prevalent form of Alport syndrome foundation, which is X-linked, a genetic form of X-linked mutations, it affects males more aggressively. And so they go into end-stage renal failure or experience disease progression much more quickly and at younger ages than females. And so it was thought that for a long time that females with Alport syndrome, X-linked Alport syndrome, weren't really affected, but that's not the case. Research over time, thanks to many important folks who have stayed dedicated to our disease and exploring it, shows that women with Alport syndrome, with X-linked Alport syndrome, are up to 30% experience end-stage renal failure at some point in their lives. It could be later, but I know Alport patients who are X-linked and female who have gone into kidney failure when they are in their 20s and 30s. This is because the type of genetic mutation you have, the genetic variant you have, and there are many, many hundreds of different kinds of genetic variations at this point, genetic variants. It depends on what your genetic variant is, and possibly other factors that can affect how quickly you experience or whether you experience kidney failure. And there are other genetic types, not only X-linked, but with all genetic diseases, they're autosomal recessive and autosomal dominant as well. And in autosomal recessive Alport syndrome, which you don't find as often as you don't find as often as X-linked Alport syndrome. In autosomal recessive Alport syndrome, we find that all females develop end-stage renal failure and can develop rather quickly. I've known young females in their teens and early 20s, again, who experience end-stage renal failure. So knowing your genetic type of Alport syndrome is really empowering and really critical for patients to understand, so that they understand what is the risk to themselves, often should they be monitored, what should they be watching, how likely is it that they'll experience end-stage renal failure at some point caused by kidney fibrosis, meaning that your kidneys over time get smaller and smaller and weaker, and they're not functioning accurately enough or doing their jobs well enough to support life, and to understand who else is at risk in their family with inheriting through family planning. And to understand with Alport syndrome, it's important that other things like our hearing gets tested over time. I have my next hearing appointment on Tuesday to see how's my hearing doing. Ophthalmological issues, because there are several different kinds of very specific eye conditions that can be caused by Alport syndrome. There are also other even more rare complications, such as diffuse leiomyomatosis, which is a collagen genetic mutation on the alpha 6 collagen gene. And that can cause all sorts of issues with smooth muscle development, such as in the esophagus. And that needs surgery. So knowing that you have Alport syndrome is so important so that you can get these pieces of, these things evaluated, monitored, and make sure that you're getting treatment.
Yeah. And, Lisa, listening to that information again, when I found out I had Alport syndrome, it was so confusing because, you talked about the genetic mutations. And again, nobody, my mom didn't have kidney failure. My dad did. Neither of my grandparents on either side had kidney failure. So it was a little bit confusing for me. And you would imagine scary to find out that I had kidney disease, and nobody that I knew had ever heard of this, the Alport syndrome. So it was a difficult thing to come to terms with. You mentioned that you have a personal battle with Alport. I travel and I tell my story, how finding out when I was 19. Of course, you see I wear glasses, so I do have a vision loss. I do have hearing loss. Talk about that part, the hearing loss, the vision loss. What is it like going through that? Because again, I went through it at a young age. It was kind of embarrassing. It was kind of, I can't hear like my peers, or I can't see like my peers because of my kidney disease. And you're trying to explain that to people and they don't understand. Can you talk a little bit about that, the hearing loss, vision loss, and what you've heard from people, how they feel about it, and how that plays a part into Alport?
Yeah, it's a really good question. And when I hear your story, it's very emotional for me too, because my son went into end-stage renal failure, needed dialysis and transplant at the exact same age, 19, just like you. So listening to your story just really resonates with me so much. It feels so close. And my son, it's interesting, TJ, because sort of a blessing and a curse. Like in our family, the hearing loss piece, though it really caught us off guard and we had no idea, and it was so new to us when my son was age 11. We used to tease him in our family because he's a real book reader. And we would say, oh, when you're reading your books, you're so engrossed in your books that you don't hear us talk.
Mm-hmm.
And then he had a hearing test at school. Very fortunately that all the kids go through it in this public school district where we're in. And he failed the hearing test outright. Like he never heard the beep. They kept on saying, listen for the beep. And he just never heard it. So he failed the hearing test, and he brought a little slip of paper home. We were shocked. And I said, maybe you have an undiagnosed, maybe you just have wax in your ears, I don't know.
Yeah.
So we were not expecting when we went to the audiologist that then she would sit us down and say, you have hearing loss, and anybody, I don't even know how you're passing your classes at school. You should, it's amazing. You really need instruments. And he said, I remember sitting there and there were little tears, coming down his he was trying to be strong. And he goes, I'm so sorry, doctor, but I don't play an instrument. And she said, oh, no, honey, I'm so sorry. I mean, hearing aids. And she didn't want to say hearing aids because she thought that would scare him. But he's like, oh, I know what a hearing aid is. But it certainly was a surprise to us. But it was the silver lining because it was the clue for us, for our family. Because I just couldn't understand where would this be coming from. We didn't have hearing loss in our family. So then I came home and, went on Google that night and looked up I sort of think the mom instinct, the sort of radar went off. And I Googled, kidney disease, boy, age 11, hearing loss. And all of a sudden, all of these articles popped up, these research articles, and I read them all, and I knew in my heart of hearts, this was it. This is what we were facing. This was really his diagnosis. Not when the doctor had said, oh, he has what you have. I thought, nope, this can't be. This matches too close. So, this was a big piece for us. I think, a lot of Alport patients experience hearing loss. Often females experience a little bit later than males with X-linked Alport syndrome, but we're all at risk. Um, it was an emotional piece. I think that was the piece for him that was the most struggle in the beginning, because as you, I'm sure, talk to patients about all the time, most people don't feel that they have kidney disease when early on in their disease, right? You don't feel that your kidneys are functioning less until you really get into the later stages of kidney disease. You don't feel those symptoms of fatigued all the time, or trouble eating or anything like that. You have no idea. You don't have this feeling. It's sort of this hidden mystery going on inside your body, knowing that you have it, but you're not exactly feeling it. So it was really the hearing loss piece all through middle school and high school that he was experiencing. That was a problem for him because it was more isolating. And it's difficult to tell people when they say, why do you suddenly wear hearing aids? He did feel like he had this sort of hidden thing going on in his body that he couldn't explain, and it was hard to explain, wait, what, your hearing loss is caused by a kidney disease? How is that possible?
Right.
But you know what? I think for him, the hearing aids, he's so grateful. We're so grateful that we live in an age of technology, that the hearing aids are like little computers in his ears, and they help him socially, they help him academically, they make sure he's not missing what's happening in the world. And he treats them like a part of his body, an extension of his body. But I do hear a lot of Alport patients talk about the isolation, the challenges of accepting hearing loss, and how challenging that can be. But again, we live in a time where technology is pretty great, and that he just has it on an app on his phone. The other night we were out to dinner, and it was super loud in the place. And so he was catching way too much noise in the background. He was having a hard time hearing me and his dad talk to him. So he just opened up his phone, turned down the background noise,
Wow.
and there you go, right there.
Right.
Fabulous technology. And then he just takes them out at night, and and that works just fine. And he's really adjusted to them very, very well. In fact, he doesn't remember, we were talking about this the other night, he doesn't really remember a time living when he had full hearing. He started wearing them at about age 12, and he doesn't remember a time without hearing aids. But it is an additional piece of the puzzle with Alport syndrome. Not everybody experiences hearing loss, but certainly many do. And what I talk to parents about all the time, in fact, just yesterday, I was on the phone with a patient whose now son, aged 11, same thing, started with hearing loss, and now started with hearing aids, is how important it is to work with the school district to make sure there's support in place, so that that child, it's not on that child or on that parent to have to tell every teacher and talk to every teacher and to put supports in place. But then it becomes part of the school district's responsibility to make sure that they communicate with the teachers to know, hey, you have a kid with hearing loss in your class. Please don't turn and do a math problem on the board and talk with your back turned to your class.
Yes.
Please, you have a microphone, please use it. This is important. Things like that. Please let the child sit where they need to sit in order to hear you clearly. Those sorts of things can be really helpful, because there's so many kids have it's such a challenge to be a tween and a teen and go to school these days anyway. It's important to have a little bit of extra support through the school system to help your child.
Yeah. And Lisa, that was one of my first questions that I have for my nephrologist. If I get a kidney transplant, do I get my hearing back? And of course, the answer was no. This is a part of your body. This is a part of your life now. But I would imagine for a lot of Alport patients like myself, I have a moderate hearing loss, but for some people who lose a greater portion of their hearing, it's a difficult thing to come to terms with. But we talked about kidney disease with you, with your family. We look at people all across this country, and I say it all the time. We don't talk about kidney disease until they fail. We have so many people who have hypertension, who have diabetes, who are obese, and they go into kidney failure. You may try to educate them about the prevention of kidney failure, Now with Alport, there's nothing we can do about it because it's genetics. But for so many people with kidney disease in America, it's an interesting conversation to have because a lot of people don't want to have the conversation about kidneys because of dialysis. And I did dialysis for 4 years, and I know a lot of Alport patients do have to do dialysis. So just talk about for a lot of young people to be a tween, to be a teenager, to be 20, 30 years old, and to come to terms with, I have to get on dialysis suddenly because of a kidney disease that I was born with.
Yeah, you raise a good point, and it's something that, boy, this is why we do what we do every day at Alport Syndrome Foundation. We are very motivated to change the stories of young people because Alport syndrome, as you know very personally, and we know in our family, can be at its most cruel in your young years. When it interrupts, I just keep on thinking of the words life interrupted. That's how I feel about these young Alport patients, including my own son, who literally, we discovered he was in going into end-stage renal failure the day we dropped him off at college. He was supposed to start college orientation, and we got a call from his doctor saying, wow, your labs are suddenly, the ones you just took last week, are suddenly terrible.
Wow.
You need to redo your labs and you need to get to a hospital now. That was his first day of college. This is often the case with young people. It comes at a terrible time in their life, just when we would say the milestones in their life are their priority, and their life is to become independent. All of a sudden now that's interrupted, and they have to stop their education or limit what they're doing with work or life, and need a lot of support. And it's just a terrible time at a very young time in life to have these limitations. So this is why we really are also motivated about helping patients understand and educate themselves about what can be done. How can you help keep your native kidneys as long as possible? You are absolutely right. With genetic disease like Alport syndrome, there's nothing you can do. You have it, and you're going to experience disease progression. But doing all you can from the beginning, longitudinal research shows that Alport patients who get on an ACE or an ARB, these are blood pressure medications, standard blood pressure medications, from an early age, even beginning at age 2, that's the recommended now, at that early age, if they're showing any signs of hematuria, blood in the urine, or proteinuria, protein in the urine, that children as young as 2 be prescribed an ACE or an ARB. And we often think, oh, well, they don't have high blood pressure. But the reason is not for high blood pressure. It's to slow the progression, slow disease progression through slowing the spill of protein into the urine. The spill of protein is what begins to cause the fibrosis of the kidneys over time. So longitudinal research, both in Europe and in China and in the United States, demonstrates that this can really help slow the progression of disease, so that you're pushing out how long you can keep your native kidneys. That's really, really important, because we want to sort of have these kids get through high school, get through college, maybe as far as they can, right? And also, I know I've listened to some of what you've talked about, which is so helpful. Diet, exercise, these are some things in our lives that we can control, and they can help support keeping your native kidneys as long as possible, staying as healthy as possible. Of course, it's not going to change the course. You will still experience, if your genetic mutation is a type where you will experience renal failure, you will. But the idea is let's push it out as far as we can, because as you know, kidney transplants also have sort of a lifespan, whether it's a living donor or deceased donor that you have your kidney from. Often they don't last forever. They really span anywhere from several years to, I often hear the number of average of 10 years, but I also know patients I was speaking to one yesterday who's had his deceased donor kidney for 37 years. That's really exciting. Love that. Right. But now experiencing again, decline, and will need a second kidney. So we want to push out that that native kidney as long as possible. So there are some things that we can control in terms of diet and exercise, but also in lifestyle choices, but also in terms of medication. And part of what we're doing with Alport Syndrome Foundation is organizing as a patient community is beyond critical to advance potential novel new therapies for our disease. Because, for example, our patient registry, which collects data on patients, researchers cannot research what they don't know. And the more data from the more people, the better. And this is what pharmaceutical companies need as well when they're looking at developing a new drug. They need that kind of data to support their application to the FDA, right? And so we support and fund a patient registry. We encourage all Alport patients. It's a voluntary thing to sign up and enroll for free. And then they provide their data over time, information about their family's history with Alport syndrome. What are their experiences? Do they have hearing loss? Did they have pregnancy complications? Do they have eye abnormalities? What are their lab results over time? Their audiograms, because nobody can study Alport syndrome audiology until we get data from patients. And so this is why we as an organization fund and organize and support a patient registry. And that's what we're working towards, is potential new therapies based on data from patients. And it also demonstrates to the FDA this sort of unmet need in our rare disease. So all of that's really, really critical. So, again, it is not something that you can control, but there are aspects of it that you can help keep your native kidneys as long as possible.
And that's a perfect segue into my next question about research and medical advances. We already talked about the hearing aids and how beneficial it is to have hearing aids in 2023 as opposed to when we found out what Alport syndrome was years ago. So talk about some of the medical advances and some of the research that's been done surrounding Alport syndrome that you know of that's been beneficial to patients. And you mentioned patients getting more information. It was a struggle for me to tell my kidney disease story because it was so emotional, so much went into it. But even listening to you and some of the other members talk about it, I didn't realize how beneficial it was to share my story for the research and for other purposes to help other people in the future. So talk about some of that research and medical advances that they've already made or some that we're looking forward to for Alport.
Yeah, it's a really good question. I will tell you, for example, research supported by the Alport Syndrome Foundation, and this is really patients supporting our organization financially, family, friends, grants from private foundations, grants from pharmaceutical companies. This is really important that we invest in research. And for example, Alport Syndrome Foundation started investing in research around the world in 2007. I'm sorry, in 2011. It was established in 2007 and started a research grant opportunity in 2011. And by doing that for a decade, for 10 years, we invested almost $2 million during that time directly in what we call seed funding. Like sort of, here's a little bit of funding to get started, and then you can publish your research and your initial ideas, and then hopefully some organizations like the National Institutes of Health or private companies with a lot more money can support you in a larger way to continue your exploration. So in 2011, we started funding researchers, and 10 years later, those researchers, not only are almost all of them still very dedicated to Alport research and still volunteer with us and stay connected to us and serve on as advisors to us on our scientific advisory research network from around the world. But that initial funding of $2 million has led to what we've tracked back, more than 1,000% return on that money. More than $22 million has been invested in additional research based on what they learned from our little pot of money. So that group of researchers has really helped demonstrate the unmet need in Alport syndrome. It was discovered, this is how we've changed the thinking by clinicians, with research showing that tracking female patients with Alport syndrome to say, hey, don't forget about them. Just because you don't see them, it doesn't mean they're actually going into end-stage renal failure, and nobody's tracking that. So that was a really important piece. So now Alport syndrome, when medical professionals are taught about it in medical school, they no longer say females are carriers. That's what they used to be taught. And now they're being taught females need to be treated. They're patients. They're going to experience disease, and they need to be prescribed medications and to be evaluated on an ongoing basis. We have now understood, in terms of understanding the genetics, now we've made a huge impact. Research has shown that more than 90% of patients are originally misdiagnosed. Yeah. So now that tells medical professionals, boy, we're missing this far too often. And then people are going into end-stage renal failure without any guidance. And that's expensive for people's quality of life and expensive for the medical system. And it's also demonstrated to us that the research on Alport syndrome, how important it is for patients who have chronic kidney disease symptoms to be asked about their family history and to have a genetic test to understand the potential genetic cause of their disease. All the research in Alport syndrome has really made that very, very clear. When I attended the American Society of Nephrology's Kidney Week in 2022 in November in Orlando, I was stunned to see that there were 26 posters from around the world about Alport syndrome. Amazing. Wow. Plus several major live presentations about Alport syndrome. And all of them, they discussed the need for medical professionals to be using genetic testing with patients. So this has been really critical. And right now, a lot of the research that we've helped fund also is tracking different kinds of genetic variants, so that there's more information for patients worldwide to say, oh, you have this genetic variant, we know that's pathogenic. We know that means you are on track to, you're at high risk for end-stage renal failure. And some genetic variants, we can say now with more confidence, yes, you have Alport syndrome, but it is very unlikely that you will experience end-stage renal failure. So this is the kind of research that's been really, really valuable. And because we've pieced together now these researchers from across the world, they serve, like I say, as advisors to us, as our scientific advisory research network. And not only do they advise us, we connect them on a regular basis. Now they know each other. For example, our next meeting is May 3rd of our scientific advisory research members from across the world, who are also meeting with our medical advisory members, which are clinicians, and they are exchanging ideas and information about what's happening in research versus what's happening in treatment. So they come together and talk, and they are acknowledged really and seen as the leading Alport experts. So they're exchanging very generously and collaboratively their research across institutions, really for the purpose of advancing potential novel treatments in Alport syndrome, which is very exciting. I will say that another exciting thing that's happening in terms of research and possibilities is that now there's stem cell research going on to support potential major innovation in kidney transplant. The idea being that this is happening in some other parts of the world. Israel has been a real leader in this, but there are some studies now in the US that are studying what happens when you do stem cell transplant from the donor, the living donor, to the recipient at the same time as the transplant, with the concept being something called chimerism, that the recipient of the kidney, when they receive the stem cells of their living donor at the same time as the organ, then over time, the recipient develops more and more stem cells from the living donor, so that they, at a certain point, reach something called chimerism, meaning that their body accepts that organ, no longer needing immunosuppressant drugs. Yes. which was extraordinary
Right.
because personally, as we do know in my own family, that immunosuppressant medications are no joke. They have a lot of risks of their own. And this
Yeah.
weird paradox is they're both helping your body accept that transplant, but they're
Correct.
also nephrotoxic over time. They're not helpful to either of your kidneys, right? So
Right.
if we can get off immunosuppressant drugs, which, they also put you more at risk for infections and so forth, especially in this age of COVID,
Right.
and other crazy viruses and infections. If we can all live without immunosuppressant medications, hallelujah, that would be a
Right.
big, a big
Right.
jump. So we're really excited about that kind of innovation. And we certainly are trying to educate patients, make sure that people understand their opportunities to participate in this kind of research. And certainly participating in organizations that are focused on this kind of research.
Right. That is amazing because I mean that's a lot of information that I did not know. And then you mentioned of course I have to take anti-rejection medication, whether it's prednisone and all of this other stuff. And of course I know I need it for my kidney, but that is amazing research and information. And thank you guys for putting forth the work. And again, it starts with people sharing their stories and having the courage to say, okay, I've been through this, but what can we do to make it better? Because medical professionals need our help to tell the story, so they can do more research. And so with that, I want to get closer to wrapping it up and talking about the Alport Syndrome Foundation conference coming up this year. That'll be the first time you and I will meet in person, and I'm excited to get out and meet you guys and share information and connect with a group of people who have this rare disease. They don't have to feel alone anymore. So I'll let you just talk a little bit about the conference and what can we expect, and what are people looking forward to when they come to the Alport Syndrome Foundation conference.
Oh, well, thanks for letting me plug it. This event. It's an event that's really near and dear to my heart, again, because that's how we really got connected to Alport Syndrome Foundation. I was volunteering, but my son, when he was feeling so alone in his rare disease diagnosis and the hearing loss and the new medications when he was in middle school, and he was really down and feeling very alone, and his social behavior had changed. And so we decided to go to the first Alport Syndrome Foundation in-person patient meeting, family meeting called Alport Connect that we'd ever been to. It was the first one that was being held since we'd been diagnosed. And that day, after the first meeting that we went to, it was a 2-day conference. And at the end of the first day, in the parking lot, when we were going back to the hotel after the first day, my son stopped us all, his brother, myself, and his father, and said, "Thank you so much for bringing me here. I don't feel so alone anymore. I met other kids who have what I have. They get it. They're wearing hearing aids. They're taking the same medications. And they're doing their best to live their lives fully. And I need to too." And the first thing he said after that was, "Hey, I can't hide anymore." Because he met researchers that day, researching Alport syndrome. And he said, "How are they going to study us and find better treatments if we hide? We need to tell the world." And it just shifted everything for him. He became an advocate and he took control, and he was helping other people rather than hiding. And it gave him a sense of purpose. And that family meeting changed everything for us. And his brother got really educated about the disease, and he started taking better care of himself at 13 years old. So by the time he was 21 and he was called upon to become a living donor for his brother, it was his choice, but he was healthy as healthy can be because he paid attention, and he knew, because he started getting educated from a young age about what his brother was going through. So that's what these meetings are all about. Our Alport Connect meeting is going to be held in San Diego, October 7th and 8th. It's free. Tickets are free. Everything about it is free. Sorry, we can't take care of your hotel if you're coming from other places, but we bring together patients and families, and also leading experts, researchers, medical professionals who treat many patients and who are considered experts. We talk about kidney health, mental health, ears, eyes, not only from experts, but also patient to patient. And so there's a full day of learning on the campus of the University of San Diego with a reception in the evening to hang out. And then the next day is really just all hangout time at a local park and beach for families to then just connect and hang out together. Because we have really found that's what's so powerful, is to have patients meet one another and share these experiences. And really, our own family has found bonds for life at these meetings, because we know other families that are living parallel lives from all walks of life. I mean, one thing about Alport syndrome, I got to say, is in any given week, I can talk to somebody, patients from the United States, from Jordan, from Cyprus, from Russia, from the UK, from China, all over the world. Patients get in touch with us. There is no ethnicity or kind of person that is, that is not affected by Alport syndrome. We find Alport syndrome all over the world. And but we walk a similar path with our experiences, and by making these bonds and friendships, it's folks to lean on. We certainly, when my son was going through dialysis and transplant, I had so many families who helped guide us on tips and what to expect and questions to ask and things that were helpful and practical. And sometimes just somebody to cry with, some moms to cry with. It was amazing. And I really attribute that to these family meetings of meeting people. So we're excited to host everybody. You can go to our website, www.alportsyndrome.org, and all the information is there on our Alport Connect page to register for free.
Yeah. And I'm glad you said that, because that was going to be my next thing. How can people connect with Alport? And if they wanted to donate, how could they do that as well? Because, of course, nonprofit organizations is not always easy. Being in a nonprofit space, I think most of us, we get into these jobs because we want to help, but financially, these organizations, we all need a couple of extra dollars here and there. So again, if anybody would like to connect with the Alport Syndrome Foundation, how can they do that? And how can they donate if they would like to?
Oh, you're asking such good questions. Well, anybody can visit our website. All of our resources are free. All of our membership, our educational resources, events, everything is free through Alport Syndrome Foundation. And how we can do that is through support, donations from family, friends, others, private foundations. And you can donate right there on our page, on our website. There's a place, that says donate. Click here on our homepage, which is www.alportsyndrome.org. You can also, and there's also information to send a check if you'd like, if you're not comfortable giving online. But also, if you contact us for any reason using info@alportsyndrome.org, we respond to emails within 48 hours. Doesn't matter where you are in the world or what day or time it is. We respond to those because we know we're patients ourselves who work for Alport Syndrome Foundation. So we know if you're getting in touch with us, it's important and you need information. So info@alportsyndrome.org, and we can email you back. And we have monthly direct connect meetings where patients can join us virtually just to talk about specific topics so they can meet others. So if you can't travel and visit us in person for a meeting, you can connect with others and get to know each other. We have families that meet each other online through our direct connects and then actually go visit each other in person, making these connections. A lot of times, if you just join our membership and you say, hey, I want to talk to somebody, then we'll Zoom like I did with you. You joined and we met. It's great to just talk to other patients. So, just getting in touch with us through our website is the easiest way.
Yeah. Well, Lisa, I thank you so much. This has been one of the best conversations I've had in the last 10 plus years of my life since I found out I had Alport. Of course, when I connected with you guys, it was kind of emotional because, again, I hadn't ever met anyone with Alport syndrome. And again, like your son, I felt like a lot of people didn't understand, going through kidney disease, a lot of people, diabetes, high blood pressure, obesity, or a lot of other things led to it, but I had never heard anybody mention Alport. Nobody had ever heard of it, but to meet with you guys and to have the conversations about vision loss and hearing loss and learning at a young age about kidney disease, it still is important to me. And I'm so excited to meet you guys this October. And again, I thank you for coming onto the podcast and sharing this information with us today.
Thanks for having me. I love all the good work that you're doing in your own community, in your own state, which also helps everybody, all of us, lifting our voices together is just it's so powerful to have patients leading patient organizations. I cannot overstate the value of that, because when somebody reaches out to you, you feel a kindred spirit right away, so patients leading patient organizations is just so important. And I'm so grateful to you for the work that you're doing, and that for you now getting connected and volunteering with us for this opportunity.
Yeah.
And I will say dialysis, we didn't talk about too much, but we all know how rough that is. So I encourage everybody, if you're a kidney patient, watch your labs, pay attention, understand how to read your labs. And if you see something that is not in range and that number is moving in the wrong direction, dialysis can be avoided if you're on top of it. And perhaps it can be avoided in some situations where you get a preemptive transplant, meaning
Correct.
You really plan in advance. You know that your numbers are slipping, the writing on the wall. Start that process early with a transplant, advocate for yourself so that you can avoid it if possible. That is possible. I'm seeing more and more patients do that, and it's out of being empowered and educated. So learn to read your kidney labs, everybody.
Yeah. But Lisa, before we let you go, any final words, any advice, anything that you would like to say to any young person listening, any parent, any grandparent, any doctor, anybody who may be tuned into this podcast?
Another great question. I will say that if you're family, if you're the adult in this situation, please don't be nervous about trying to educate your children about living with kidney disease. I have found now in all these years of doing this work that those folks who get educated, even beginning at an early age, their outcomes are better. They're more prepared. They have more control. They learn early how to deal with diet and hydration. And it gives you more of a sense of control, and education is power. And in this case, I do believe. I've seen too many patients who think it's too tough a situation, too tough of a topic for their young person. But then once their young person with Alport syndrome goes off to college and goes into renal failure because they weren't paying attention, but if they have more power, more education, and they can help take care of themselves, the better. The outcomes are better. So we have all sorts of resources, as I know other patient education, patient organizations do too, to help educate young people at their own level. Like we have a coloring book, we have videos, we're working on other information for patients and families. Start early, and that's really helpful. I know it's hard, but there are resources out there, and I encourage you to do that because your outcomes can be better.
Absolutely. Well, I thank you so much for all of your information. I thank you for the courage to do what you're doing. And I thank you for being honest and sincere. I could hear it in your voice. I could still see the emotion, because it is a powerful thing to watch people that you love go through something that they can't even control. So I thank you. I know this podcast is going to be going on a long time, so I would love to have you back to share more information and more patient experiences. But again, thank you so much for tuning in.
Thank you. Right back at you, TJ. We'll talk to you soon, and thank you so much for having me. I
Absolutely.
really
And
appreciate
that
it.
will wrap up this week's edition of the Mississippi Kidney Foundation Kidney Cares podcast. Thank you all for tuning in. We'll see you next time.